Hi. Welcome everyone to Chamberlain University's next Mastermind Session, where we are going to be discussing the topic Nursing Innovation in Practice, One Nurse Leader's Impact on Changing Patient Outcomes. We are honored to have two very special guests. One, Dr. Kathy Mao from Cleveland Clinic. She's a Senior Director of Nursing Education and Professional Development. And our very own Dr. Jill Walsh, who is Dean of our doctoral program here at Chamberlain. And we are going to go ahead and get started with introductions for Dr. Mao and Dr. Walsh. Kathy Mao is a Senior Director of Nursing Education and Professional Development at Cleveland Clinic, and she's also a 2015 graduate of Chamberlain University's doctoral program. Prior to her leadership position, she spent a number of years as a CNS, specializing in adult populations, as well as working with Cleveland Clinic's stroke program as the program manager. During her doctoral journey, she continued with her passion for the population that she started working with all the way back in her days with the Boy Scouts, and then ultimately implemented a proprietary tool that we're going to allow her to give us her brilliance in how it evolved in the development, and then obviously the implementation of her tool, Vital Scout. So we want to just dialogue and just have a conversation and really listen to Kathy's brilliance regarding her own personal journey, and then also being able to share some, shed some light and share some wisdom with closing in on the Year of the Nurse 2020, as well as September being Nursing Professional Development Month. We feel that this is a very relevant topic, which is also why we have Jill Walsh joining us, who is Dean of our doctoral program. She's been with Chamberlain University since 2012 and has been Dean of our doctoral program since 2017. So welcome, Kathy. Welcome, Jill. Thank you for being a part of this Mastermind series. This is the first one that we are highlighting, the Nurse Innovator. We've been doing a number of series that are relevant to some topics that are outside of maybe the scope of nursing professional practice, and seeing as though we have just such a robust group of thought leaders, we're just honored to have Dr. Mao here with us today to talk about her journey with Vital Scout, and we can just kind of look at some areas of opportunity to share with the nursing aspiring nursing professional development leaders, and looking at forging ahead as to the future of nursing professional practice in terms of innovation. So Kathy, why don't you go ahead and just give us a little bit of a take on where your journey began, because it's a really interesting story. So I think everyone would love to hear that.
So it's hard to believe I've been a nurse now for 30 years. I started in med-surg nursing, like a lot of people do, really just trying to hone my skills. And then I found my passion, which was emergency nursing. So I spent about 10 years as an emergency nurse. And it was during that time that my sons got involved in Boy Scouts. I became a leader and started volunteering as a nurse at some of their events. And that led to something that was life-changing for me, which was volunteering to work as a nurse at the 2005 National Boy Scout Jamboree. This is an event, if you're not familiar, it happens usually every 4 years, and it brings about 50,000 Boy Scouts and their leaders together for 10 days of a high adventure. So you're essentially setting up a city in overnight, and to manage that population, you have to have medical facilities to really manage what you would manage in a city that size. And we set up 25 different medical facilities to manage everything from cuts and bruises and sore throats to, because of the high adventure, some pretty critical traumas. It was during that time that we had a mass casualty heat incident where we had 1,500 Boy Scouts go down with heat stroke and exhaustion. And through that process and working through that, I really started to reflect on my own practice and where I worked. And I recognized that we didn't have a mass casualty program or process in place. So when I went back to my organization, I talked to my leader and I asked if that was a possibility, if I could work on developing this plan. And I did, and we rolled it out, and I was able to provide education and ongoing development related to that. And that led them to asking me to become educator for not only the emergency department, but also ICU, just because I was doing so much education and they just kept asking me. So it seemed a natural progression. During that time, I went back to school to get my master's in clinical nurse specialist. And then they asked me again to come back for the next Jamboree, which was in 2010. But this time they asked me to serve as the chief nursing officer. And what's significant about that is that it's always, for years and years, these jamborees have happened. It's always been medical driven, medicine driven. Physicians were the executive leaders, and nursing was not at the table. So this was going to be the first time a nurse actually had the opportunity to sit at the table to make executive decisions. I was able to create the organizational structure, policies and procedures. I created the education, brought together a team of over 100 nurses from across the country to provide this care that we gave. That was where I learned my leadership skills, and it's also where I started that I would say my innovative thinking. When you're dealing with traumas or whatever was walking through the doors and you're working in a tent with not the same supplies you normally have, you get really creative fast. And that's really the first step in any innovation, is just kind of problem solving. So back at home, I finished my master's. I became a CNS. I continued to develop the stroke program I was working on. But I also had I looked at nursing practice and continuous improvement. So within that role, I was brought into root cause analysis. We had a patient who had shown signs of deterioration over the course of several days. And there was not a good outcome for this patient. And as we looked back, we could see that deterioration happening. But if you looked at any single set of vital signs, you would not have noticed something was wrong. You had to really look at the trend from baseline and then the changing trend over the course of several days to see it. So as I started to look into what were the factors contributing to this, I did a lot of interviewing, and I found out that there were so many contributing factors, and that to me this wasn't okay. Like, we needed to work on giving our nurses better tools to address this. So I went to the literature to see what was out there, and I found that this was not a problem just at our hospital. This is a nationwide and even worldwide problem with failure to rescue and really recognizing those early signs of deterioration. And they found early warning systems, and that's something a lot of hospitals and health systems are using now. And I thought that would be great for helping them to recognize the symptoms, but it just didn't take care of all those other contributing factors that we had discovered were contributing to this problem. So I developed a proposal, and I went to executive leadership and asked if I could work on this project, creating something within our medical record to really promote and support nurses' ability to identify those early signs of deterioration and to intervene in a more timely manner, and to really use their critical thinking skills to determine how to intervene. And I was able to get permission to do that, to pull an interdisciplinary team together and to really move forward this project that we ended up implementing in 2015 at my hospital, which was our pilot hospital. We did some changes after the first year and looking at outcomes, and we piloted at the second hospital with the changes. And now we've rolled it out across 11 hospitals in our health system. And it's been quite the adventure, and we're seeing really impactful changes in nursing practice and really in patient outcomes from this. It's been exciting.
Thank you, Kathy. I think it's interesting that really necessity is the mother of invention. And you had mentioned, I think, was it 2010? They nominated you to be CNO of that Scout Jamboree. So that even the title of the tool called Vital Scout, right, was a culmination of just being in that moment and being, part of the solution. I'm hoping that you received at least an honorary Eagle Scout badge for that. I mean, that's like the epitome of, what the Boy Scout, I think, motto is. Just being solutions driven, and I can't think of anything better. But I mean, what an amazing journey, and what an amazing story of just being in that position with your skill set and identifying just that need, and that need just takes on a life of its own. And then, I'll fast forward all the way to, I think it was about, 2014, 2015. It was about the
Mhm.
time frame that you implemented
Right.
the tool
2015 we
clinically.
implemented.
Hmm. Um, could you talk through a little bit more about the implementation? I mean, it's and there's a lot. I know there's a lot to it. There's a lot of moving pieces and parts. How was that from the position, from the nursing perspective? Who did you have to bring to the table? Because it definitely takes a concerted effort and a large team to, I think, scale. And I know you've worked with IT. I know you've worked with, there's a lot of different pieces to the
Mhm.
project. So I was wondering if you could talk to that a little bit too.
Sure. So in order to drive this across our organization, we actually set up an rollout schedule, and we would go hospital by hospital. And we had our core team, which, as you mentioned, it included IT analysts. We had physicians, we had nurses from quality, nurses from education. So our core team then would go to each hospital, and we would develop a playbook. So we had a standard rollout schedule with certain things happening at certain times. And we would meet with the CNO and her core team, and we would match up positions. So I was the clinical lead, so we would have somebody at that hospital who served as the clinical lead. And then, nursing informatics there was somebody on our team and somebody on their team. So, and then we created a schedule for the education, because we did very specific nurse education. I met with pretty much every leadership group you could think of in each hospital, and we did presentations. Suzanne Fink was the person who is our technical lead. She was also a nurse, and we kind of tag team that. We had physician education. We'd go to different departments that were on our units and would see Vital Scout, so that they knew what it was and what the different colors and things meant for that visualization, and really creating situational awareness. And then we would track outcomes, and we would stay in touch and continue to provide support for that hospital as they went live, and then in the time after. And then we always made sure we came back and we did some educational sessions and scenarios with the staff nurses to make sure that they were using the tool correctly. So we did that with all 12 hospitals that we went to. So it was quite the coordinated effort with each hospital. And each hospital you go to, well, we're all part of the organization, and we have the same standards and policies and procedures. There's a different culture at every
Yep.
hospital. So you have to take that into consideration as you're moving things forward. I learned a lot in that process, and really my DMP program. So I was in the midst of my DMP program while I was developing and implementing and rolling this out, and it provided so many of the tools and resources and knowledge I needed to be able to really see this project from identifying the problem straight through to implementation, research, and publication. So I was really happy I had chosen to do my DMP at that time, because I don't know that I would have done the same things or had the same success if I wouldn't have.
Yeah, I think timing is very relevant for so much of your success. And Jill, I didn't know if you wanted to share anything. I know this is probably the Kathy's been recognized as she's run several awards for the Vital Scout tool, as well as being recognized for a lot of different innovations with Cleveland Clinic, as well as she's an esteemed alumni of Chamberlain. Jill, wouldn't it be wonderful if we, if all of the, doctoral projects and, we're of this caliber? And I realize not everyone is, but I think that, timing played a significant role with Kathy being in the position where she could kind of do both at the same time, just fulfill kind of that academic journey in conjunction with developing and implementing a tool that has clearly saved lives and really forged nursing as kind of the frontline decision maker at the head of a very global system. So, Jill, go ahead. I don't want to take up all the time.
Well, thanks, Colleen. No, I did want to just add that, it is always so wonderful to hear these stories because, again, Colleen, as you mentioned, not all of our projects can be at this caliber, but we really hope that they all can because we are preparing nurses at the doctoral level to lead transformation in healthcare. And I loved, Kathy, that you talked about the tools that were provided. And so that's part of what the DMP program is about, is providing those tools for nurses to identify problems, search the literature, translate that evidence to the bedside to improve outcomes. The other thing that I heard, Kathy, that I really liked, and I think this is important too, is the DMP practice scholar or the DMP prepared nurse leads interdisciplinary teams to improve outcomes. And so listening to your whole process, it really was a nice, strong, solid project that did, in fact, improve patient outcomes. So great job.
Thank you.
And I think, Jill, thank you for that. I wonder if between Kathy and Kathy, you can speak to this lens because you're kind of leading the charge with how many nurses are in the Cleveland Clinic system now? Is it still about 11,000 caregivers? I think it's more than that
higher
now.
than that. Yeah, I don't know the number
it's
at the top of my head, but we've added a few more hospitals, so we're definitely higher than that.
Yeah, so it's a pretty significant feat, and filling in, these are big shoes to fill on top of everything else. But being in the position of leading nursing professional development with Cleveland Clinic, there's obviously a place for different academic journeys. And as Jill had mentioned, the DNP kind of satisfies the practitioner side of things, where and you mentioned that you articulated probably best, where it's a collaborative effort where the nurse leader is taking the charge and really leading from the front in driving a solution and being able to implement it on such a large scale that it's measured not just in patient outcomes, but just in overall quality that's being developed, not from a different department, but specifically from nursing. So it takes a special skill set. And I know that we also, the Cleveland Clinic also employs nurse scientists.
Mm-hmm.
And Kathy, I was wondering if you could speak to that, I guess, symbiotic relationship of, that would be your PhD, right? So
correct.
The PhD journey is a little bit different versus the doctoral journey for various reasons, but they both have their purpose, right? So
right.
I was wondering if you could.
Yeah, so Cleveland Clinic has an Office of Research and Innovation, and our nurse scientists are PhD prepared nurses who really come alongside any nurse who would like to do research. So they kind of guide them in, and depending on their background, they do more or less coaching and guiding. We had a PhD researcher, nurse scientist involved in our Vital Scout project also. So it was a great collaborative effort between bringing the clinical pieces and I have some experience with research, but not a lot. And I really needed the nurse scientists to come alongside and guide what's the correct methodology to use and look at. It was a struggle to find, at least for this project, how do you demonstrate what you prevent? If Vital Scout works well, then you have to. Then you're going to just demonstrate great nursing care. You're not going to show deterioration in a lot of your patients. So working one-on-one with the nurse scientist, we really dug into metrics and what we could pull from that to really demonstrate outcomes. So I've worked with them on several different occasions, and it's been a great experience.
So what are some things in Jill or Kathy, you could probably both speak to this from your lens. Now that we're at the end of 2020, we've seen I think, probably some of the most significant disruptions in healthcare, for a variety of reasons. And I know that we've talked, and obviously I'm an advocate. I think we, as an organization, we've always been an advocate for nursing as a profession. What are you seeing, in terms of some needs and some areas of opportunity for growth and development for future nurse innovators? There's definitely, each hospital, and I know Kathy, the Cleveland Clinic has their own very, systemic process for developing nurses, and just kind of shaping and being very transparent about all the different directions they go, because there's a lot, right?
Mm-hmm.
So there's a lot of things that nurses can do now that they weren't able to do 30 years ago. And I know, Jill, you kind of have that, lens from what you're seeing on the academic side. What are some things that, now that we're at the end of 2020, where do you see, the direction of nursing innovation going from your perspective, with some of the projects that you have you kind of get the inside scoop, so the insider's take on, some of the things that they're doing.
Well, thanks, Colleen. I think, really you've hit on it. Nursing has truly evolved as a profession, and the future of nursing has really taken us to where we are today. We have met the challenge for having more BSN nurses at the bedside, and we've met the challenge for having the percentage of doctorally prepared nurses that the future of nursing put forth for us. And so we really are seeing nursing leading change, implementing evidence-based change, looking at how we as nurses can transform healthcare by improving the quality, safety, and patient outcomes. So it's a very exciting time. We have this spirit of inquiry, and nurses now ask the question, why are we doing it this way, and how can we do it better? And I think, we really are looking at, in many cases, this culture of evidence-based practice, and also the culture of innovation, new ideas, how can we do it better, thinking outside the box. And we're given the platform to be able to make these changes based on the evidence in the literature. Truly exciting times.
I would agree. I think due to some of the things that we're seeing with COVID and other situations, it's really presenting nurses with the opportunity to innovate. I know our organization has a culture of innovation, so we actively are seeking and supporting nurses in innovation. But as we look at the care that they're providing and the different things that as we learn more about the disease process and things like that, the way we're having to change how we practice it. And nurses really are at the forefront of creating innovative tools or processes to support either caregiver safety or just improving patient care and outcomes. So I think we're seeing that I think we're seeing that across the board. Just the nature of the situation we're in is we're having to innovate and problem solve. And if you kind of think of, if I'm problem solving, I'm probably being innovative, and you start putting those together, that's going to lead you to that natural progression of, is this something that others would want to learn about or do also?
That's a great segue into one of the final questions I have for Kathy, which is just imparting that wisdom. I'm sure at this juncture, with your success with Vital Scout and all of the things that you were able to learn that you couldn't have predicted, without walking through the journey, have you been in a position where you've precepted or well, I know you've precepted, but just been able to kind of use that to guide other nurse innovators through that as well, based on your hindsight and obviously your leadership? What could you, if you were to impart any type of wisdom for future nurse innovators, what would you you mentioned problem solving. I think that's a really good place to start. And then what? What would be the next
I would
step?
say identify your passions, because if you are going to get behind something 100% and really move something forward, you have to be passionate about what you're doing. And you have to be diligent and not give up. We had people telling us that what we were proposing would never happen. And if I would have believed that, we would never have created what we did. So you have to believe in yourself. You have to surround yourself by a team that also believes the same thing, and find those stakeholders who really will support you and help you to move that project forward. I think those are your key things to starting with an idea and moving it to innovation and then actually implementing it.
Thank you, Kathy. Joe, what do you think? Do you have any imparting words of wisdom for nurse change agents or innovators?
Well, for parting words of wisdom, I think it's just an exciting time that we're living in. And nurses, whether they're at the doctorate level or the baccalaureate level or the master's level, should be in the literature every week. We want to search the literature for the best evidence, implement that best evidence, see what types of outcomes you get. And so having that spirit of inquiry, and as Kathy mentioned, your passion, getting into the literature, translating that evidence to the bedside. Research literature can sit for 17 years before it's implemented. Nurses need to be consummate users of the research as evidence in the literature, pulling evidence from the literature, implementing it, seeing how it works. And I just love Kathy's comment that Cleveland Clinic does have that culture of continuous innovation. And I think, nurses are best positioned. We're at the front line to identify problems, identify solutions, and when that solution isn't present in the literature, to work collaboratively with the nurse scientists to develop those new ideas, those new processes, to really bring in those innovative new ideas as we transform healthcare.
I would agree. I think it's so vital that nurses are lifelong learners. Your career takes a lot of different side paths or journeys, and you have to continue to stay up on what that evidence is. And so you need to create within yourself that desire to really learn and seek out that evidence and what's new and what's so you can drive your practice in the right direction, and then even translate from that into your own practice settings, what you're seeing.
Thank you both. I think between some of the things both Jill, you mentioned, and Kathy, you mentioned, what I hear, and oftentimes when we're talking with nursing students or new nurses, oftentimes there's this race to get somewhere. And I think what I hear from both of your personal journeys and just professionally from your lens is really identifying that passion. And sometimes that takes some time, right? I think it takes time to develop, which patient population you truly want to solve for. But that starts at the bedside. And I think that, we like to encourage and really support that night shift med surg nurse that's trying to identify where that zone is. And I know it's a journey, and I think for most of the nursing profession, there's no straight linear path. It's very crooked in some ways, but I think that's one of the things that as well that I hear you saying is just to be open to opportunities to find that area. And sometimes there's no crystal ball, right? There's no prediction of exactly when that's going to happen. But what are some suggestions for new nurses coming into the profession? Areas that what could they do? How could they maybe get a little guidance? Maybe and I know Cleveland Clinic does a great job of this. So I guess this is a leading question. But encouraging new nurses to find a mentor or find somebody that works in a specific arm of, say, advanced practice nursing before they, get into that field. And as you mentioned, and I think this echoes throughout, most of the successful individuals, is just having that passion. And Kathy, you were in the right place at the right time, and you didn't know. So hindsight is 2020, and you look back and go, wow, being a Boy Scout mom, it's
Right.
amazing when that's the foundation, and then it just evolved into what it is today, which is amazing. So I just want to applaud your journey. I know I'm honored that you were a part of this conversation, and I really hope that we're able to just highlight and really continue the conversation with the nurse innovator. You definitely have set the bar, but I also know that you're leading the charge for thousands of other caregivers within your respective organization, as well as the rest of many other organizations that look to your leadership as well. And you're the voice, and it's such an honor and a privilege to witness that and to be a part of that. So thank you, as well as the patients and families. I'm sure you've been able to realize, the results of your efforts, especially with the early detection system and with Vital Scout. So yes, thank you. And Jill, I didn't know if you had anything else you wanted to share, but I wanted to thank you as well. I think part of the success with the innovation is the academic components that can help the practitioner identify and kind of streamline, and then from a project standpoint be able to actually implement. And like you said, it's a continuous learning, right? So it's important for nurses to realize that it's a journey, and I think patience is also a virtue in that journey. But somewhere along the way, there are, methods of, there's something for everyone. And I think more than ever, as we go into, we wrap up 2020, going into 2021, we have no idea. I mean, a year ago, I don't think any of us would have predicted where we're at today with COVID. So it's definitely a disruptor, but I think we're starting to see and hear the term innovation more than we ever have, and I'm confident in the solutions being driven by nurses, just because they are in the forefront, and I think it's a profession that we need to continue to elevate, support, encourage, and really look to for those grand solutions to improving patient outcomes overall on a large scale. So I wanted to just give you guys an opportunity to, if you wanted to have any final words, but this is wonderful. I'm just so happy that we were able to, we overcame some technology humps with this. But Kathy, again, just there's just so many things that you've done to contribute to the overall well-being of so many people. And Jill, the academic journey is nothing, to not acknowledge. So I appreciate both of you being a part of this discussion, part of this conversation, and hopefully this will inspire and, give some insight as well into those future nurse innovators that are all just kind of sitting there waiting for that aha moment. So
I would say, just as a parting thought, you kind of mentioned it, just really look for opportunities and take advantage of them. That is what I've done almost my entire career, and it has taken me on a journey. And if you're always seeking out those opportunities, you're going to grow, you're going to develop, and you're going to become the best nurse in whatever area that is possible. So just say yes, get involved.
Just say yes.
And I would add to that exactly that, seek out those opportunities, but keep your eyes open. Ask the question, why are we doing it this way? And can we do it better? And again, that's that spirit of inquiry that is so exciting. And Colleen, you had mentioned, new nurses. I think new nurses come in with a fresh set of eyes, and they can see things differently. And, we do have that. Well, we've always done it this way. But why? There might be a better way. And as we've been saying with COVID, we have identified that some of, these sacred cows can't be sacred during COVID. We've done things differently, and we've had to, and we've been innovative and come up with some really great solutions in really these difficult, challenging times. So I think, COVID is certainly not anything we expected, but out of COVID, I think we're going to have some really new, innovative practices.
I agree. Thank you. Thank you, Jill. Thank you, Kathy, for joining us today. Appreciate it. I think hopefully the messaging and I know it's definitely going to resonate. If anything, it's to your point, Jill. I think we haven't even seen the results of that spirit of inquiry. And, I'm just thinking in terms of just the education industry, the education system overall. I have kids. I think we all have kids that are trying to figure out this whole, and teachers trying to figure out this whole virtual world, and everyone's navigating. We're all students again, right? Everyone's a student of our current environment. So more to come, and definitely the best time to be in that innovative mindset, and looking for solutions and trying to do things better. So, well, that is going to conclude our session for today on nursing innovation. I just wanted to thank Kathy and Jill once again for joining us. It's been an honor. Really appreciate both of your insights and wisdom and being able to bestow that in this type of platform. So in the spirit of technology, I thank you for walking through this with me. And I also wanted to remind our audience to join next Wednesday at 1 p.m. Central Time for the next Mastermind Session, and look forward to some more new and exciting topics, and you'll be hearing more from us. So thank you very much for joining us, and until next week.